A woman who is 20 weeks pregnant calls the clinic because she is experiencing pink tinge discharge for the first time. The nurse should advise the patient to dash. A. Decrease her activity level. B. Call back if the symptoms have not subsided in 24 hours. C. Call back if she experiences an increase in pelvic pressure. D. Seek medical attention immediately. E. Make an appointment to be seen tomorrow. The answer is D. Seek medical attention immediately. This woman could be experiencing preterm labor. A 20-week pregnancy is not considered viable. She should be seen immediately to determine if there is a cause such as cervical insufficiency, premature dilation of the cervix. Hannah is a 21-year-old woman who is presenting at the emergency room for severe vaginal bleeding. She is 32 weeks pregnant. Upon further examination, she is found to be suffering from abruptio placentae. Which of the following assessment findings would be of least concern to the nurse? A. Shortness of breath. B. Decreasing blood pressure. C. Bleeding from oral mucosa. D. Small red dots on the skin. E. A tender uterus. The answer is E. A tender uterus. Abruptio placentae is a serious condition where the placenta inappropriately and prematurely detaches from the uterus. Women with obstetric complications such as abruptio placentae can quickly develop disseminated intravascular coagulation, DIC. DIC is a clotting disorder in which the blood inappropriately clots. Severe bleeding can also occur as clotting proteins become scarce. Symptoms of DIC include blood clots, and bleeding into the tissues such as the skin and oral mucosa. A decreasing blood pressure is concerning due to the severe bleeding caused by the combination of DIC and abruptio placentae. Shortness of breath could indicate the presence of a blood clot. Although uterine tenderness is of concern, it is common with abruptio placentae and does not indicate an immediately life-threatening condition. The nurse completes a cervical exam on her laboring patient. She determines that her patient's cervix is 1 centimeter in length. How would the nurse describe this length? A. 50% effaced. B. 30% effaced. C. 100% effaced. D. 25% effaced. E. 25% effaced. The answer is A. 50% effaced. The normal cervical canal is 2 centimeters in length. Effacement is the thinning of the cervix as the body prepares for delivery. Thus, a 2 centimeters cervix is 0% effaced and a 0 centimeters cervix is 100% effaced. The nurse helps the healthcare team to deliver a healthy baby girl. Upon delivery of the placenta, the nurse notices that it is not 100% intact. What is the nurse's first concern? A. Infection. B. Deep vein thrombosis. C. Pulmonary embolism. D. Hemorrhage. E. Tissue perfusion. The answer is D. Hemorrhage. If the placenta is not whole upon delivery, a piece may still be present in the uterus. This inhibits the ability of the uterus to shrink in size and may cause hemorrhage. The missing piece needs to be located immediately. While monitoring a laboring patient, the nurse notices that the fetal heart rate at baseline varies from 110 to 145 beats per minute. The nurse's first action would be which of the following? A. Decrease IV fluids. B. Have the mother bear down, C. No action is required. D. Turn the mother on her left side. E. Administer oxygen at 1 liter per minute via nasal cannula. The answer is D. Turn the mother on her left side. Marked fetal heart rate baseline variability of 25 beats per minute or more may be cause for concern. Similar findings may indicate that there is poor oxygenation of the fetus. Turn the mother to her left side, to increase perfusion, and notify the physician. Note that this is still in the normal range for fetal heart rate for a laboring patient, about 130 beats per minute, and that the low end of this spectrum is of slightly more concern. Which of the following is not a risk factor for gestational diabetes? A. Asian ethnicity. B. High blood pressure. C. Prior birth of a child with a congenital disorder. D. Newborn weighing 9 pounds 2 ounces. E. Advanced maternal age. The answer is A. Asian ethnicity. Asian ethnicity is not considered a risk factor. Hispanic, Native American and African American ethnicities are considered risk factors for gestational diabetes. Others include maternal obesity, previous pregnancies with gestational diabetes, delivery of a very large baby, and a family history of diabetes. A woman arrives at the birthing center for evaluation. She thinks she may be in labor. She is multiparous and experiencing contractions every 3 minutes. Upon examination, the nurse notes that she is 5 centimeters dilated and 50% effaced. Which stage and phase of labor is the woman experiencing? A. Stage 1, Phase 1. B. Stage 1, Phase 2. C. Stage 2, Phase 2. D. Stage 1, Phase 3. E. Stage 2, Phase 1. The answer is B. Stage 1, Phase 2. The woman is experiencing the first stage labor in the second phase. The first stage of labor exists when the woman's cervix is dilating from 0 to 10 centimeters. The second phase of the first stage occurs during dilation from 4 to 7 centimeters and when the cervix is 40 to 80% effaced. The second stage of labor is when the cervix is dilated 10 centimeters until the delivery of the baby. The third stage of labor is the delivery of the placenta. The first phase of labor is the onset of labor until the cervix is dilated 3 centimeters. The third phase of labor is when the cervix fully dilates from 7 centimeters to 10 centimeters. The nurse is called to a room by a laboring patient. The patient complains of a backache and appears restless. Her fingers are trembling and beads of sweat fall from her forehead. The nurse suspects she might be experiencing which stage of labor? A. Stage 1, Phase 3. B. Stage 1, Phase 2. C. Stage 2, Phase 2. D. Stage 2, Phase 1. E. Stage 3, Phase 1. The answer is A. Stage 1, Phase 3. During the third phase of the first stage of labor, the cervix dilates from 8 to 10 centimeters and effacement reaches 80 to 100%. The woman will be less able to focus on other things and may require more support from support persons. Labor may progress quickly and the nurse should be preparing for the second stage of labor, in which the cervix is fully dilated at 10 centimeters. Andrea comes to the office for a prenatal visit. She mentions that lately she has been excessively hungry, thirsty, and very tired. Which of the following would the nurse suspect? A. Gestational diabetes. B. toxoplasmosis. C. Anemia. D. Parvovirus B19. E. Preeclampsia. The answer is A. Gestational diabetes. Polyphagia, excessive hunger, polydipsia, excessive thirst, and polyuria, excessive urination, are 3 hallmark signs that point to diabetes. While increased fatigue is common in pregnancy, combined with the other 2 symptoms, it may be concerning. Preeclampsia involves elevated blood pressure, swelling of the hands and feet, and protein in the urine. Toxoplasmosis results from infection by a parasite and can affect fetal development. A amniocentesis is performed to diagnose the infection of the fetus. Depending on the suspected duration of infection and the gestational age, drugs may be administered to decrease the chance of the parasite from infecting the fetus. Anemia and parvovirus B19 are unlikely to cause all 3 of these symptoms occurring together. All of the following may trigger asthma in a pregnant woman except dash. A. Moist hair. B. Esophageal reflux. C. Stress. D. Animal dander. E. Unwashed sheets. The answer is A. Moist hair. All those listed may be asthma triggers with the exception of moist hair. Typically, cold air may trigger asthma exacerbation. Additional triggers include exercise, respiratory illness, smoke, and mold.